Hello everyone, my name is Erica Paddock. I'll be doing the head to toe assessment at SNHU. This is just my walk around the room tour. These are just some of my utensils I'll be using during my assessment. My patient's side table and the paper that they will fold. Okay. This is my lovely volunteer. Tools here.
Hello.
Hello, my name is Erica. I will be your nurse today.
Nice to meet
Sanitizing
you.
as I walk in, also closing the door for patient privacy. I'm here to do a head-to-toe assessment today. Is now a good time?
Yep.
And do I have permission to do the assessment?
Yes.
Okay, awesome. I'm just going to verify my patient. You can just state your name and date of birth.
Barry James Paddock, 7/22/1992.
Perfect. All right, Barry. So I'm just going to do an overall kind of look at your skin, your hair, and your nails, okay?
Okay.
And so just taking a look at your hair, and it's evenly distributed. Your skin, I don't see any irregularities, any rashes, bruises, scarring, no edema present in the lower extremities or the upper. Your nails look great, well maintained. Okay, let me just see these fingernails as well. Awesome, no issues there. I'm gonna just check the thickness of your skin. Perfect, no irregularities. And now we're just gonna test skin turgor. And that's just a little test that we do to see how well your skin kind of snaps back for dehydration purposes, okay? We're gonna move it to the head portion of the assessment. So we're just gonna palpate the sinuses. So right here, we're just palpating frontal sinuses. Awesome, no edema, no pain, no masses. We're gonna move on to maxillary sinuses. Awesome, no pain, no edema, no masses. Going to feel carotid pulses. Great. Okay. From here, we're gonna kind of just move on to the eyes, nose, mouth, ears, and then we'll get into the neck and everything else. Also, while I'm here, I'm just going to assess for any nodules in the axillary, throat, or head. Perfect. Awesome, none are felt. No swelling either. So now we're going to move on to the eyes. So on inspection, sclera is white. I don't see any visual, any discharge coming out of the conjuncti. I'm going to just palpate now, if you want to close your eyes, and we're going to be doing the upper and lower lids. I'm just looking for periorbital edema. None is present. I'm going to be using my pen light to assess for constriction and accommodation. Right here. Now for accommodation. Perfect. I don't have a Snellen chart here with me today, but if I did, I would place myself at the bottom of the patient's bed. I'd hold my chart. I would ask the patient to read down the lowest line that they are able to read. And they would be doing that with the left eye only, the right eye only, and then both eyes together, just to test the patient's visual acuity if he had any complaints or deficits in that area. Next, I'm going to move to the nose. So we're just going to inspect the nares. We're looking for symmetry, Brady, any issues breathing. Perfect, both are patent. Any issues with smell?
Nope.
Okay. Next, we're going to move to the mouth. So I'm going to have you stick your tongue out. Perfect. And the mouth is pink and moist. I don't see any cuts or lacerations on the tongue or gums. Can I see your teeth, please? Teeth are intact. Awesome. While we're here, I'm going to have you just stick your tongue out. Up, down, left, right. Perfect. And then to do a gag reflex, I would have a wooden instrument with me, and I would place it on the pad of the tongue, and I try to get back there for it to touch the pharynx to elicit a gag reflex from our patient. Awesome. Just clip this here. I'm going to inspect the ears, and so visual inspection. Awesome. And then I'm just going to do a physical, and no edema, pain are present. And the external ear canal looks intact, no issues with hearing. Okay. I'm just going to hold your jaw while you open and close your jaw, and that's just testing for TMJ. Moving down to the neck, we're going to be looking for JVD, jugular vein distension, and that would be suspicious of a cardiac issue, which I don't notice. Trachea is midline, neck is symmetrical, nothing to note on that. We're just going to feel the carotid arteries. Great. Okay. I'm now going to auscultate both the temporal and carotid arteries. Awesome. Awesome. We're now going to move to the cardiac portion of the assessment. And so in this portion, we're going to just be kind of talking through everything that the heart does and why I'm checking something out, okay? Alrighty, so just for circulation purposes, right, because our heart circulates our blood, we're going to check capillary refill, and that's going to be brisk, less than 2 seconds, and that's what we want. We're going to do that both in the fingers and the toes, just to make sure our body's circulating blood the right way. We're also going to check pulses on the entire body. So we've checked the carotid, we've checked the temporal, we've checked the carotid. We're now going to check the brachial. And we always want to do this symmetrically so that way we can notice any changes or differences between the two. And your pulses are strong, within rhythm. Okay, that was the radial. Just have you move your hands to the side. We're just going to check femoral. Perfect. We're going to check popliteal. That's right under the knee. We're going to check behind the ankle. Awesome, and then check dorsalis pedis. Awesome, and nice and strong and regular. And if I had any difficulty finding any pulses, I would use my Doppler, and I would just use a hospital-proofed safe marker just to kind of mark where I felt them. That way to make it easier for the next physician or nursing staff to go in and find them. Now moving on, we're just going to listen to some heart sounds. Okay, so in the right second intercostal space, we're going to hear our aortic valve. Okay, and then same thing, second intercostal, but in the left side, we're going to listen to the pulmonary or pulmonic valve. Now we're going to hear Erb's point in the third left intercostal space. Perfect. Just pull this down. And I would be listening under the clothes, but for the purpose of this assessment, for school purposes, we're going to do everything above the clothes. And then the tricuspid is the fourth intercostal, and the mitrals are fifth intercostal space. And then I'm also going to listen to the PMI, and that's basically just where you hear the heartbeat the best, and it's between the fourth and fifth intercostal space, and it's mid-axillary line. Great. I'm also going to flip my stethoscope over and listen to it with my bell as well, because it just helps hearing any cardiac sounds and murmurs or things like that. Awesome. While I have him in this position, I'm just going to go ahead and assess my aortic and renal arteries. Awesome. Awesome. Okay. So that concludes the portion of our cardiac assessment. We're going to move on to respiratory, so that's going to be kind of just about your oxygenation status and things like that. So we're going to inspect the chest. We've done that. Obviously, I'm not taking my patient's throat off. So there was no scarring noticed, no lacerations, skin is evenly distributed, no irregularities in the skin tone. It's appropriate for this patient's ethnicity. So after inspection, we are now going to palpate, and so I'm just going to palpate the chest and make sure we have even chest rise and fall, and that it is symmetrical with each breath. I'm now going to percuss, and so we're going to do 5 in the front and 7 in the back. If you feel any pain with these, let me know. And again, with everything, we're going to be doing it symmetrically. Doing okay?
Yep.
Awesome. I'm going to have you stand up. just turn to the back. And if you could just turn just a bit more so the people at the camera can see. Awesome. And if you feel any pain at all, just tell me, okay?
Okay.
And now that I have you in this position, we're just going to do a couple more things before we go back to listen to interior chest sounds, okay?
Okay.
So I want to check for fremitus, and so I'm going to have you repeat the words 99 every time my hands touch your back like this, okay?
Okay. 99. 99. 99. 99.
Awesome. I'm also going to assess a CVA tenderness right now, and that's just going to help give me an idea if you have any renal issues, like a renal stone or things like that, okay?
Okay.
Any pain?
No.
Okay, awesome. I'm going to just oscillate now the back, the posterior portion, since you're in this position, and we're going to do 9 locations. So every time my stethoscope touches you, just try to take a nice deep breath in and out, okay?
Okay.
Awesome. I'll have you go ahead and lay back down. We're going to do the same thing now, but just on the interior front portion of your chest. And we're going to be doing 5 landmark sets right now. Awesome. Okay, so now we're going to move towards the gastro portion of the assessment. So I've already inspected the stomach. I'm now going to auscultate all 4 quadrants, and we're going to be starting in the right lower quadrant. If I don't hear a sound for the first, if I hear a sound within the first 5 seconds, I'm going to just move over to my next quadrant. That's awesome. If not, I'm going to stay there for about 15 seconds and hope to hear a sound, okay? I'll be doing these in each quadrant about 2 finger breaths away from the umbilicus. Okay, and we have hyperactive bowel sounds noted right now. Someone just ate dinner, I'm assuming.
I did.
And now I'm going to do the same percussion. It's going to be in a zigzag pattern, and it's again going to be starting in the right lower quadrant and working its way. Any pain?
Nope.
Okay, and I don't feel any masses, protrusions. Areas of tenderness, none of that. Awesome. All right, thank you. So now we're going to kind of move towards the musculoskeletal portion of the exam. Okay, so if I can have you just sit up again. So we're going to start at the neck. We're going to move our neck, flex, extend. We're going to touch our ear to our shoulder, other ear to other shoulder. Any pain with that?
Mm-mm.
Okay, we're going to do our shoulders, maybe shrug up and down, maybe lift your hands up and down. Any pain?
No.
Any pain in your joints, stiffness?
No.
All right, we're going to do the same thing with our elbows. We're going to flex, extend. Any pain?
No.
What about in the wrists?
No.
Fingers?
Nope.
Perfect. While you're here, I'll have you just grab as much as you can. Awesome. Equal strength. Great. So I'm going to have you just lay back. We're going to do the same thing now with the hips. So I'm going to actually just have you kind of turn to the left, turn to the right. Any pain?
No.
All right. Can you lift this leg up? Can you bend the knee? Any pain?
No.
Okay. Put it back. Now can you do the same with this leg? Bend the knee. Awesome. We're going to have you just flex and extend the ankle. Any pain at all?
Nope.
Okay, awesome. Great. I'm going to have you take this heel and run it down this leg. Then I'm going to have you do the same thing with this foot. All right. So I have two objects here with me. I have a cotton swab, ear cleaner, and just tweezers, and I want you to be able to close your eyes and tell the difference in sensation. And so one's going to be a soft sensation, and one's going to be sharp. Okay?
Okay. Sharp. 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 Soft. 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 Soft.
Okay, we're going to do the same thing with your upper arms.
Sharp. Soft. Sharp. Soft. Sharp. Soft.
Awesome. Perfect. And while I have you in this position, we're going to just, I'm going to have you close your eyes again. Only using your right hand, I want you to feel this object and try to tell me what you think it is.
Paperclip.
Okay. And this object?
Cotton ball.
Okay, we're going to now do the left hand.
Cotton ball.
Okay. Now.
Definitely a paperclip.
Awesome. Thank you so much. I'm going to use this marker just to trace a number or a letter in your hand, and then if you want to just repeat back to me what I'm tracing.
8.
Perfect.
An X.
Perfect. Awesome. Thank you. I'm going to have you stand up, and we're going to do a couple of assessments standing up. I'm just trying to stay in the screen. To be able to see our feet here. If you want to just push back a little bit. Awesome. So for the first assessment, we're going to be doing a foot to heel walk. You want to just do foot to heel. Perfect. And then if you want to walk back on your tippy toes. Perfect. And then if you can walk back on your heels. Awesome. Thank you so much. I'm going to have you, while we're standing up, we're going to do a couple more tests. So this is the Romberg test, and it just tests for balance. So I'm going to have you stay with your eyes closed. I'm going to give you kind of a little shove, nothing too painful, and just to see if you can hold your balance. Okay, perfect. I'm going to have you turn this way. We're going to do the whisper test. And so I'm going to have you close this ear. I'm going to stay on the left side of you. Excuse me, the right side of you. I want to do the opposite of the ear. About 2 feet or an arm's length away. And take a nice deep breath. And I'm going to recite either 3 words or letters in no particular order. And I'm going to have you just rehearse them back to me, okay?
Okay.
A1S.
A1S.
Okay, and we're going to do the same thing, just opposite side now.
XL4.
Perfect. Awesome. While we're standing here, I'm just going to give you this piece of paper, and I would like you to fold it and place it on the ground. Awesome. You can get back into the bed now, sir. Thank you. Just gonna move the camera back. Okay. Staying in the camera during this. So we're just gonna test some neuro things right now. So if you want to just put your eyebrows up and down for me, puff your cheeks in and out. Perfect. Smile. Clench your teeth. Awesome. We are going to assess memory. So long-term memory. How did you spend your birthday last year?
My wife threw me a wonderful party.
Awesome. Do you remember the kind of cake that you had?
Cheesecake.
Awesome. I'm going to tell you a sentence, and then a little bit into our conversation, I want you to repeat that sentence back to me, and that's going to help me assess your short-term memory, all right? I took my dog Kaya to the park. Okay. Can you tell me what year it is? Sorry, I know it's a long assessment.
Pardon me. 2022.
Perfect. What holiday is coming up?
Easter.
Great. Do you know where you are right now?
The hospital.
Perfect. We're going to do a little bit of math. It's okay if math is not your strong suit. We ask that you just try your best. Okay?
Yeah, okay.
So we're going to count from 7 to 100 in increments of 7.
Okay.
And you can begin when you're ready.
Okay. 7, 14, 21, 28, 35, 42. Yeah, that's about the extent of my math abilities as far as 7.
We have
So
some adventitious findings.
I promise it's not a neurological deficit, man.
Okay. Not all of us are good at math. We can try a different assessment at a later point just to assess our numerical math skills. Can you repeat back that sentence that I asked you earlier?
I took my dog Kaya for a walk in the park.
Perfect. All right, well, I think that's all that I have on my to-do list for your head-to-toe assessment for today. I want to thank you for allowing me to do this and cooperating and taking the time. I'm going to put hospital non-slip socks on. My patient has their side table right beside them. We have the nurse call light. Ring if you need any assistance at all. For anything, we're putting up our side rails on both sides of the bed for patient safety. If my patient were on any type of cardiac monitoring, I would make sure that all of it's appropriately applied before I exit the room. And if you don't need anything else, I want to thank you for your time.
Thank you.
And that concludes our head-to-toe assessment. And thank you. Bye.